filming?
Hi, this is Michelle Walker, and I'm going to be doing 2 videos for the catheter checkoff. First, we're going to start with the in and out catheter on the male, which I have here, Mr. Berrigan. And first, since we're using supplies and equipment, we're going to go through the 12 safety practices for a patient. The first one is going to be you verify the care plan of the client. Secondly, you want to wash your hands before and after, so good hand hygiene before and after client care or handling supplies. Then you want to verify facility procedures and policies and assemble necessary equipment and supplies needed. Fourth is to consult with manufacturer recommendations when using equipment. And fifth, you want to knock on the client door, identify the client with 2 identifiers. You want to assess the overall condition of the client. 8, you want to explain your procedure that you're about to do to the client and then provide privacy. You always want to check for allergies as well, but that's not part of the steps as you're introducing to the client and about to perform the procedure. Then you want to bring the bed up to the highest level for good body mechanics. You want to don PPE if indicated. Upon completion of the procedure, you want to lower the client's bed to the lowest position, raise up the handrails if indicated on the care plan, and then of course put the call light within reach of the client. And then step 12 would be to, if there's any abnormal findings, report it immediately to the charge nurse. And that's it for the 12 steps. So we're going to go ahead and do the in and out catheter on the male. So we're going to go ahead and set up our sterile field in between the legs of the male. We've got him up kind of with the relaxed frog legs here. And like I said earlier, you want to make sure that you check for any allergies, making sure that if they have any iodine allergies, that we're not going to be using iodine. You can use hydrogen peroxide instead for the cleaning of the meatus. Okay, so we have our sterile field here. And I want to grab my sterile gloves out of there. Set that off to the side. And then we are also going to grab our drape that we're going to put underneath the buttocks. The shiny side is going to go down. Watching your sterile field here. Okay. And then the last thing that we're going to pull out before we put on our sterile gloves is the fenestrated drape. Which the fenestrated part is just going to go right over. If you had a male part there, it would the penis would stick out and kind of gives you extra sterile field. Now everything else is sterile. We've got this whole field is all sterile, so we are going to make sure that we don't cross over it. We're going to put on our sterile gloves now and start with the catheterization. We're going to be collecting a urine specimen with this in and out cath. So I'm going to put this sterile field in the gloves over here so that I can put my urine specimen on there when I'm done. And what we first want to do is clean the meatus. So we're gonna grab the urine cup. Lubricant. We've got the label for the cup here that you want to have set off to the side so that you can put at least 2 identifiers on that to send off to the lab. And I'm going to pretend that I'm opening this, but you want to open it up, leave it on the side, and you want to take your non-dominant hand and hold the penis with your non-dominant hand straight, and take each swab starting at the tip of the meatus in a circular motion, and you want to go downward and then drop it off to the side, or if you have a little trash can or something on the side, you don't want to put it in your sterile field, but you want to put it, if you have a bag or if you have the trash can by the side, you want to put it in there. And then however many other swabs that you need, and start at the ending point and keep going downward in a circular motion, and the last one and go all the way down. And then you want to, what we would have done was set the catheter inside the lubricant, and I would take, so I'm going to pretend that it was open and it's lubricated, keeping the penis steady with your non-dominant hand. You want to take the lubricated catheter, and there's a lock if you want to use it on here, but you want to set it to have them bear down as if they're going to pee, and you want to push in. And on males, since they have a longer urethra, you're going to go down about 7 to 9 inches, and then, but basically once you see the urine coming out, you want to go 1 to 2 more inches, and then you want to anchor, because it's sterile, you want to anchor it with that non-dominant hand so that it does not come loose. Have your urine cup, and like I said before, it would be in the lock position here, and the urine would go straight into the cup there until you have your desired amount, and you would take the urine cup, set it onto that sterile field there, let the bladder drain, and then once the urine has stopped, then you can remove the catheter out, and you can take your glove and hold it over the catheter like that so that you can throw the whole catheter away. And the sterile part is now over, so you can get on regular gloves to clean up and to put the lid on your specimen, submit that to the lab with the identifiers, provide any perennial care that you need on the patient, and clean up your sterile field. And that's it for the in and out catheter and the urine specimen, sterile urine specimen collection. Thank you.